Hey guys, in this video I'm going to share with you some unbelievable updates as regards the UK health and care visa. So if you're planning to apply for the care visa, or you have someone who's planning to apply for the care visa, it's very important for you to watch this video before you go ahead with the application. And also I'll be sharing with you a particular care home in the UK that are currently recruiting healthcare assistants, both those who are UK residents and also international applicants. If you're looking for a job as a care assistant and you want to watch this video till the end, and if you're coming across my channel for the first time, please click on the subscribe button to join the amazing growing family. And for my returning subscribers, thank you guys for being here. I really do appreciate you. So without further ado, let's get right into the video. Despite saying this a couple of times on different videos on this channel, I still get to meet people who still make the same mistake that I try as much as possible to inform everyone on this channel not to make, and that is not reading the their contract properly. Now, I got someone who just recently moved into the UK, and for the past 2 months since he's moved into the UK, he hasn't gotten one single shift from his employer, which means that he hasn't been paid a single dime because the contract is signed with the employer was a 0-hour contract, which means that if he doesn't work, he doesn't get paid. And that's not the way permanent jobs in the UK works. Permanent jobs in the UK, you're entitled to a minimum salary, and if you decide to pick up extra job and extra time, then obviously you get paid more. But this person signed a 0-hour contract and he's been in the UK. The employer has been unable to get him a shift to work in order to make money, and he hasn't made any money in the last 2 months since he moved into the UK, which was why he contacted me. And I felt I've actually made a lot of videos on this channel as regards health and care visa. That is important for you to make sure you read through your contract before you sign. Now, because many of these care homes and care agencies have a way of making your application look so good, and you eventually end up getting the health and care visa from the home office, because they probably tell the home office you're going to be earning at least 23 to 25,000 per annum. And when that is done, when the UK home office discover that, oh, your application has met all the eligibility criteria, they give you the visa. But when you get into the UK, many people discover that many of their care homes or many of their care agencies actually don't have adequate job to go around, for every of their employees, which is really sad. And the frustrating part of this is that this is not just for those who came in with visa sponsorship. Even those who are working part-time as healthcare assistants, those who are on tier 4 visa, who are students, many are also going through a lot of challenges trying to get shifts. I could remember last year in 2022 when I was working as a care assistant. During my holidays, I was able to get enough shifts. During my holidays, I barely don't stay at home at all. I'm always working because there are a lot of shifts to work. You end up working like 3, 4, 5, sometimes 6 days every week because there are jobs. However, in 2023, I really don't know what's happening. Probably the number of healthcare assistants has increased drastically in the UK. I honestly don't know what's happening. If you're also experiencing the same in your city, please state in the comment section, tell us the city you are, and how easy or how difficult it has been getting shifts from your care agencies or your care home. Now, and the other thing is that if you're working with an agency, it even gets more difficult. For agencies, you only get to work if you're given a shift. Unlike people that are working in care homes that are permanent staff, obviously they might not be able to get overtime or extra shifts, but they'll still be able to do their normal 37.5 hours. That's why I tell people, if you're planning to come to the UK on a care visa, try and get a job in a care home. Yes, I understand that working in a care home can be more difficult because you have a lot of personal care to do, and the trend or the part of health and care that most people are actually moving into now is the support part. Most people are trying to get a job as a support worker, as a domiciliary carer. Now, in as much as these two particular jobs are good, ensure that you are getting a job with an organization that owns a particular license. I don't know if you understand what I mean. So what I mean is, don't get these jobs from agencies. There are so many agencies out there that are now wishing visa sponsorship for support work. By the time you get the visa sponsorship, you enter into the UK, or if you're in the UK, you have to relocate to the city they've got their jobs, and you discover that they don't have enough shifts to be able to meet up with your bills, which is going to be very difficult for you the moment you sign the contract with them and you have gotten the visa from the UK Home Office. And if you're already on a health and care visa with a particular employer, the only way you can get out of that visa if you're able to see another sponsor who is willing to act as your sponsor for a new visa application. Now, I also need to mention that if you're planning to, or you're currently on a student visa and you're planning to move, to the health and care visa, however, you're still keen on looking for a job in your profession. So let's, for instance, you came to the UK for a master's degree, and towards the end of the program, because obviously you only have the choice of going for the health and care visa or the post-study work visa, and you decide to opt for the health and care health and care visa, it's also important for you to know the challenge that comes with that particular decision. Now, if you decide to move to an health and care visa, it gets really difficult to be able to switch to your professional job, because you're going to have a lot of work to do on the health and care visa, and it will be difficult if you eventually get a job that probably doesn't sponsor. And one of the ways to eventually get your professional job is to, even if it's a job that doesn't sponsor you but is in line with your field, you can take up that job for like a year and then look for jobs that will be able to sponsor you on that field. However, if you're already on a health and care visa, you can't do such a job. So even if you eventually get a job that can't sponsor you, you can't go back to your post-study work visa the moment you migrate to the health and care visa. And I also hear a lot of people saying that, oh, they are no longer care homes or care agencies are no longer employing people from Nigeria. Is it going to affect Nigerians in the UK? The truth is, no, it doesn't affect Nigerians in the UK. And however, I've seen a lot of people who are still coming to the UK on the same health and care visa. Although it's really been difficult getting visa sponsorship job on the health and care visa, because the demand for this job is really increasing, and many of these care homes and many of these care agencies are beginning to monetize this desperation or this rush for the health and care visa. However, I have one particular care home in the UK at the moment who is currently employing those who are UK residents and also those who are outside the UK, and they provide a lot of relocation package. They help you with free accommodation, they help you with airport pickup and many of those stuff. And this particular agency is called Care Solutions Recruitment Agency Limited. Now, it's a national home care provider and recruitment specialist. They hire national and global healthcare professionals to work with the organization. The agency has always been proud to offer employment recruit globally, because they understand that care is universal. Now, this particular agency is a UK visa and immigration license sponsor, and they can help you to realize your dream of working in UK and in care across the UK. They are offering sponsorship to qualified nurses and senior health care assistants through the new health and care worker visa. The relocation package for UK carers, their specialist recruitment team are offering eligible candidates a full support package, including assistance through the process, support with relocation, airport pickup, free accommodation for the first 14 days, and subsidized accommodation for up to 1 month. Now, the welfare support doesn't stop there. They also support you throughout your period of sponsorship as your career develop with Care Solutions Recruitment Agency Limited. Now, at this particular agency, they are currently looking for motivated people to join their team as domiciliary care workers, and your job responsibility will include to provide service of care to service users to enable them to lead an independent lifestyle as possible. This care service will involve a program of personal care and household management that is personalized for each service users in terms of a care. So obviously, for you, many people that are watching my video, you already know the job role of a care assistant. Basically, you're going to be able them to be able to live independently and help with their personal care. So these are some of the things you need to know as regards the UK health and care visa at the moment. And honestly, guys, it's really been difficult getting jobs. I know a lot of people who are currently on my waiting list trying to get visa sponsored jobs for the care homes. However, it's really difficult. A lot of demands for this, and people are willing to pay any amount to get this visa, and it makes it really difficult to be able to get organizations that are willing to sponsor you without you paying a dime. So that's that about that. So if you find this video, also click on the like button. If you have any question, please state in the comment section. If you're coming across my channel for the first time, please click on the subscribe button to join the amazing growing family. And for my returning subscribers, thank you guys for being here. I really do appreciate you guys. So this will be the end of this video, and I'll see you guys in my next video. Thank you.